Thank. Can I get a volume?
They're ready.
Oh, they're ready whenever you are.
You want to say something?
No,
You ready to rumble?
I was going to just tell them we were having technical difficulties.
All right, we're going to go ahead and get started. Happy New Year, happy 2025. This is the Public Safety Committee meeting at our new time at noon, so thank you all for making it. We are having some technical difficulties, so we are not streaming on Facebook right now, but we are live on Channel 5. So hopefully if you're on Facebook, you see our post that directs you to Channel 5, and it's being recorded as well. So we'll get started. We don't have it listed on the discussion items, but we will start with our updates from our chiefs. So if Chief Hall wants to start us off, and then we can have Chief Oberg after that. And then we'll go through our discussion items 1 through 4, and it should be a quick committee meeting.
Good afternoon, Council President, Council members. This is very brief this month around, New Year. We're still trying to make this work for everybody here and make it meaningful for you so we're not wasting your time. First thing up is calls for service. This is a full year over the years, so we're basically just a little under, not statistically significant, of last year. But what I would point out is that the 911 calls, which are the calls in green, are down, while the crime check calls are up. This is something that I said I'd bring to you last month, and this is the response time for the calls for service. Down at the bottom are the priority 1, or the most serious calls over year. So the green is 2024, and then you can see that we're basically the same on priority 1s, basically the same, a little bit quicker on priority 2s, basically the same, a little bit quicker on priority 3s. So response times we're very happy with. These are the abandoned vehicle, Hulk vehicle parking violation calls for service. Once again, they're all up over time, over the time period, but a little bit down for abandoned vehicles and Hulk vehicles this year over last year. Calls for service, deaths, mental health, and opioid crisis. Once again, these are all up over the average of the time period. And the DOAs continue to be of concern. We're still digging into those. What we call quality of life calls. Another issue that we're starting to dig into with a little bit more in depth are the eviction calls, which continue to go up, giving our unsheltered homelessness crisis, and with an eye towards prevention, we want to take a look at why evictions continue to go up, calls for service evictions, and if there's something that the different systems, the city systems, county systems, and state systems can do to prevent future unsheltered homelessness issues.
Chief, excuse me, could you just tell me the scope of when you get an eviction call, really what is required of the police officer at an eviction call?
It's primarily preserve the peace. So we're there to simply make sure that there's no violence, that everybody behaves themselves, and that the order is served without any issues.
And is that scheduled? Would someone call to schedule that service from the Spokane Police Department?
Mike? I have to call in the expert.
Okay.
Good afternoon, Council. So the evictions are primarily the responsibility of the Sheriff's Office. And when we're called there, we're just called to assist. We don't have jurisdiction or authority to effect evictions, so that's primarily the Spokane County Sheriff's Office. Sometimes they'll be working alone in the city and they'll ask for an officer to come help stand by to make sure they stay safe.
Thank you for that clarity.
Okay.
Thank you. Going right into the unlawful camping citations, as you can see, they're up and up over 147% over last year. Sit and lie citations remain down. Pedestrian interference also up considerably, 2024 over 2023. Something we talked about last month I wanted to bring to you is to show you what the traffic citations look like, or what traffic enforcement looks like throughout the city. We broke it up by speed cameras, red light cameras, and what officers issue. And as you can see, speed cameras, red light cameras are by far issuing more tickets than the officers can themselves. And just to go back, these are mixed. So with the officers, they can cite for civil citations as well as criminal citations. The cameras are all civil citations. Bless you. We also did something a little bit different. I'm continually hearing about what does crime look like in Spokane with some comparisons. So we picked some like cities that are very close in our population throughout the western United States. So anything west of the Mississippi, staff just went out and grabbed some like populated cities to take a look at where we compare. The dark blue line in the middle there is Spokane. The outlier on top is Lubbock, Texas. The two outliers on the bottom are Chandler, Arizona, and Boise, Idaho. So we're very much in the middle. We align pretty closely with Tacoma and Reno, Nevada. And I just want to point out this is violent crime only, 2020 to 2023, and these are FBI stats. You've all seen this before multiple times. This is basically an end-of-year stat. The line represents population. The bar graph is crimes against persons. Very close to last year. Same data broken up by precinct. We broke up assaults, both aggravated and simple assaults. They are down for the year over last year. Same data by precinct. Domestic violence offenses by year, just a little uptick this year over the past 2 years, but still pretty close. And as you recall from last month, we broke up the domestic violence offenses to show you what the vast majority are, and that's aggravated assault, intimidation, destruction of property, violation of a protection order, and simple assault. We've all seen this before. These are shootings with victim injury. A little bit over last year, but still below 2022. These are shootings without injury, very close. And we just combined all the shootings together. Very similar to the past 2 years, which is concerning to me. We need to make some headway in this area, and we are developing a violent gun crime reduction plan that you'll be seeing in the future.
And so, Chief, these include the shootings that happened in the month of December that were?
This is inclusive of the month of December, yes.
Okay.
Going back to the arrests, once again, it's extraordinarily difficult to parse out custodial arrests from citations, but overall arrests, we are up significantly this year over the past 2 years. These are just arrests by types. Trespassing by far leads the pack. The green just shows what officers initiated on their own, as opposed to the light blue, which is crime track, the dark blue, which is 911 calls. We wanted to show you some use of force data. As we discussed in the past, between 2019 and 2020, there were significant legislative changes that we attribute to the reduction in uses of force, and they've remained fairly stable. These are deadly force incidents. Kind of go up, down, up, down. The average over this time period is 3.8 a year. This is just a timetable of things that we believe have impacted use of force, starting in 2014 with crisis intervention training, going all the way down to 2022 where there were additional legislative changes to clarify some of the changes that made in 2020 and 2021. Staffing update. It speaks for itself. We just put 6 individuals into our basic law enforcement academy. So that's 6 folks that we have in the academy now. We have another 4 folks out in FTO. I believe, actually, I don't believe that's correct. I believe we have more than that out in FTO. But we still have, math is hard, 26 vacancies that we're trying to fill on the commission side. The other one I want to point out is the dispatch and the record side. Those are not our professional staff vacancies. That level of vacancies in those 2 units creates quite a bit of stress for our staff as they're trying to make up for those vacancies. The workload doesn't change.
And on that, how many of the temporary employees are people filling those roles, or is that with the temporary employees we still have 7 and 6?
I believe that's with the temporary employees. So those represent full-time employee vacancies.
Gotcha.
And that's it.
I'm wondering in the future if we could also show some numbers around just simply contacts between law enforcement and the public. I'm curious, like the 9,800 citations that officers issued, how many contacts does that represent? Is it, 50% of those contacts end up in a ticket? Is it 25%? But then also, I think what's important maybe just to point out on that slide is while the red light cameras and the speed cameras can certainly issue citations, they're not necessarily catching what else might be happening in that vehicle. And I think that's just an important factor that the public should, think about when we're talking about technology versus individual officers.
Absolutely. And we're also trying to dig a little bit deeper on the back end and see how those tickets are resolved differently from an officer as opposed to a speed camera.
Gotcha. And then one other, there's an article back in December, and there was reference to kidnapping as we're talking about individuals needing treatment. And I just wanted to bring up Ricky's Law, and I just don't know if that's something that you're aware of in the state of Washington, and kind of the opportunities, I guess, for lack of a better way to put it, to assist individuals who are truly addicted and need the help. And so I just wanted to put that out there, that is a law passed by a Democrat lawmaker on the west side, and we need to be, I think, utilizing that law a lot more.
We're very well aware of that, council member. Part of the problem is, particularly in the Spokane region, but I think throughout the state, is, as I've said before, is where do you take them?
Yeah.
If it's the ER, they're out before a DCR can get there to do the assessment. So it's trying to find that place where we can keep them long enough to get a DCR there to do an assessment and then go through the process.
And that's true. I just want to point out there are legal means to, help in those individuals who maybe don't want to be helped.
Agree. There are legal means. The capacity to fulfill
Yes.
that is an issue.
Yeah.
Any other questions? All right, thank you for that that update.
Thank you.
Next up, we'll have Chief Oberg with the fire update. And I just wanted to remind folks, too, that we do have public testimony that comes after all the staff briefings, which will be our first public testimony at committee.
Good afternoon and Happy New Year, Council. Did you? Okay, I just want making sure you got it. Still on holiday.
Yeah.
Well, I'll start. It's just pictures, so you can look at the pictures later. Just starting with our staffing report, our current relief pool stands at 16. That's taken into account some fourth quarter retirements. Our 2025 Recruit Academy is set to start on March 3rd. Right now, that will be filling, we have 18 FTEs that are vacant, so we're trying to get that all of those 18 FTEs filled in that recruit academy. That'll be a 16-week fire academy with a 5-week EMT academy at the end. So those folks will be coming out in Q2 and onto the streets to start their field probation. Overtime, just ending up 2024, want to highlight, so our 2024 overtime, uniform overtime, so our operational overtime, we ended up at 6% lower than what 2023 was. That was still 22% over what our overtime budget was, but I've mentioned this at a couple of other sessions, and I do want to highlight that just those numbers taken alone really don't tell the story. I do feel really strongly that I think we did a good job of reining in our overtime in that we did have an effective 14.3% pay increase that really was not reflected in what that overtime budget was. But when you look at our hours, we had 19% less overtime hours in '24 than we did in '23, and that was without doing a 2024 academy. So not exactly where I want to be, but I do feel like we made some good strides in 2024 going in the right direction, and we're continuing those into 2025. Thank you. So that just that shows the hours on how the hours increased, and really again they're if you look at those, they do tell the story where our hours the second half, not only with vacation, but that's when you start to get the results of people retiring and separations from service. Oh, you're going to control it and everything for me? Thank you. No, I like it. So we're still tying up our overall 2024 run numbers. This was our busiest year ever. So exactly what that percentage looks like, I don't have, but December was also a pretty busy month with not only an overall increased call volume, but increased call volume just for working structure fires as well. The good news to add on to that, though, one, we want to try to get those calls for service down. We'll talk about nurse navigation and some EMS things that we're continuing to work on, but our response times also improved. So a lot of times you don't see an increased call for service and a decreased response time occur simultaneously. And I don't know yet that we saw that throughout the year, but at least in November and December, we did see that. This was our heat map. This is going to look pretty familiar. I don't see any trends in what this heat map looks as far as where we're seeing our overdose impact. So clearly in the downtown corridor. December, our overall overdoses were up, both in our Narcan delivery. It is difficult for us to say that our call for service that is specifically overdoses up because those come into us in a variety of ways. So they're not always just dispatched as that being the primary issue of it. We don't know that when we go. We might go on an unconscious subject. We might go on a cardiac arrest. So they get to us in a variety of ways. So sometimes that number is a little bit nebulous to be able to try to track. But overall across the board, December, we did see an increase from November. I want to spend a little bit on this on the care slide. So our average referrals has continued to trend up through the entire year. We are just missing one position to fully realize our CARES expansion. So we have 3 CARES social workers, and we're still working on hiring that last one. And those 2 additional have really hit the ground running, and we're seeing an impact. We're seeing a positive impact from them already. The table to the right is one where I want to spend some time. So CARES will spend, obviously, a significant time with the clients once they get that referral, and they'll spend days, average 73 days that they spend with just one referral off and on, making sure that they are connecting them to the right resources. But one of the things, when we go down to that lower table, When CARES gets a referral, they will look at what were the interactions with 911 that that person had 3 months prior to that CARES referral, and what was their interaction with 911 3 months after that. And it's a 72% decrease in interactions with 911 after they have a CARES referral. That is significant. So I think, again, we are putting some great effort into realizing how we get people connected to the right resources. We know, and we know not just in Spokane, but we know across the country that 911 so many times is the answer because people just don't know where else to go. And so if we can get them connected to the right resource, the more efficient and more effective resource, that benefits all of us. So that's the good news. The rougher news is if you look at the overall numbers, they only have 55 referrals. So, I mean, that's moving the needle very, very slowly. And I think that's our challenge as a community, is to figure out how we move that needle with greater numbers, getting those people connected to the right resources. Let's see. So moving on to nurse navigation. So this is one of the ways, if you remember, we started this in Q2 of 2024. This is where when somebody calls 911 and it starts with the SHREC dispatchers, if they think, hey, this seems to meet this criteria that our medical direction has said we don't believe this needs an ambulance or a paramedic or EMT response, they will go through some triage questions and then they connect them to the nurse navigation nurse line. That nurse line will then take that call and work on either getting those people referred to a mobile urgent clinic, self-care, virtual care, or even Lyft or Uber rides to the ER in lieu of an ambulance ride to the ER if the urgent clinics aren't open. So when you look at these, the top graph, it's really that middle blue bar. Those are the ones that are navigated, meaning they navigated away from having a Spokane Fire Department or an AMR ambulance response, and they got care in some other way. The bottom table shows what care they got. So that yellow bar, or excuse me, the green bar that you really can't see very many, that's the mobile urgent clinic. The blue bar is they were given a Lyft or Uber ride to the ER. Typically, again, those are done in after hours when there's not an urgent clinic open. The yellow is referral to just some other source, and there's a variety of other clinics that they would be referred to. The RSC that was self-care. So the nurse just talked them through whatever their own self-care were. They didn't go through virtual care. They didn't go anyplace else. And then the dark blue is virtual care. So nurse navigation is making an impact. We continue every month. We have meetings with both the SHREC team that is taking these calls and the nurse navigation team to try to figure out how we can continue to increase our numbers with nurse navigation. The numbers aren't where we want them to be, but it is making an impact. Moving on to fuel mitigation and wildfire. So these two side by side, the map on the right is a public-facing map that we have on our city website now, where people can look at what fuel mitigation projects have been done, what are in progress right now, and what are planned to occur. And the reason I put the map on the left, that is from the county wildfire plan that shows where our risk is in the city. And none of those are surprise. We know where our primary WUI risks are at. But as you can see, where Lance's team, where Chief Dahl's team is doing fuel mitigation is exactly overlaid with where our highest WUI risk is. And moving on to the next slide, I think in 2024, we have 700 acres, approximately 700 acres that have been mitigated We have 600 more that are in progress or on planning right now that we have revenue streams identified for. And tomorrow is a great one. The Sansucci neighborhood, that fuel mitigation project starts tomorrow. That neighborhood, as you guys are aware of, has some unique challenges in that it has one road in and one road out. And that's the road that we will need to use as emergency responders, as well as the community would need to use to evacuate that area. So really getting that evacuated, or excuse me, getting that mitigated is going to be a good thing. There is a lot of arborvitae and juniper in there, which is a really high risk for us. And it's a 55-plus community, so there are some issues that we deal with as far as their ability to quickly evacuate. So again, Chief Dahl's team has done a great job partnering with Shriners owns that land, as well as the neighborhood council, and that'll be exciting kickoff tomorrow, get that project done. I mentioned already that our Recruit Academy starts March 3rd. The HVAC replacement for Station 1, which was the ARPA funds that you all gave to us, is still scheduled for February 2025. We continue to work on our behavioral response unit expansion. That is still just the one unit, 40 hours a week, but we are continuing to work avenues on getting that expanded to be a wider footprint. We are working with our medical director, Dr. Edminster. We've had conversations with Chaz on bridge scripts, and that is where we can get people, whether it's through medicated assisted therapy once they've done that, or whether it is people that just need that antipsychotic or that bridge script until they can get to another resource. That is where we lose a lot of our clientele, in that they are either off those meds or they don't have those prescriptions. And so Dr. Edminster has been really working tirelessly to try to solve that problem of how we make sure that people at least have that bridge script until they get to that final resource destination. We continue to look at the 2025 legislative priorities, both state and federal, that impact the fire service. We are working on just some preliminary RFQ for not only the Latah Valley Station, but what does that look like for both Station 1 and potentially Station 6, which is the West Plains Station as well. And then ending with some more fuel mitigation. We are partnering through the Spokane County Wildfire Mitigation Coalition, helping with some other projects, whether it's just through leadership, whether it's through understanding revenue streams, because we all know whether it's inside the city or not, throughout the county and the surrounding area, any of those wildfires do significantly impact us. And that is it, unless there's any questions.
Councilmember Dillon.
Yeah, thank you so much for this, Chief. One item I think would be helpful just from the data set, and maybe I missed this in the packet. I love the heat maps. They're very illustrative, but some of the raw data, I think, to get a sense of where some of the disproportionate raw data sets are looking like. I remember it was very illustrative with SPD when we saw, okay, within this sort of square mile, we are seeing this percentage of calls for the rest of the city. That would be helpful to kind of delineate. And then also just want to flag, I've been speaking with Nick Jeffries for a while about some of the fuel mitigation work, and we have run into some issues, in particular with the Bluff, with the BNSF right away. I'm not sure if you're aware of that, but especially between the section of Inland Empire Way up to the tracks and then kind of lower Cliff Cannon. And so I don't know if, we've spoken with BNSF, sometimes things get cold. I know that there's obviously a lot of concerns about doing work in the right of way, and I understand that it's very dangerous to work near train tracks. But I think as we saw from last year with the Cemetery Gate fire, it could have been much, much worse if that work hadn't been done, especially near those tracks. So anything that we can do to kind of help make headway on those conversations would be appreciated.
Chief Dahl, do you have anything to add to that?
Nick's been trying to be in contact with BNSF.
Hey, Chief, save it for the microphone so that everybody can hear. Yeah.
They can hear him. him everywhere.
That's right.
Nick's been in contact with BNSF. You know, we did do the project out near Old Trails at the curve there. The last 2 months, they've kind of gone quiet as far as contact information and trying to be able to set up. So we just discussed that, in fact, this morning, Councilmember Dillon. He's reaching out to try to get a couple other BNSF contacts. We're hearing through the grapevine that there was still some sore feelings from 6 or 7 years ago and the fuel train stance that the city took at that time and so I think there's some hand-holding there that we need to kind of sit down with BNSF and maybe smooth some old feathers over.
I was just going to ask Chief O'Burke again about your legislative priorities from the Metro Fire Chief Association. So I know we have some for our city. Are you looking at these would be statewide initiatives?
Yeah, we develop both state and federal priorities, and that list is just now getting finalized, so I'll be happy to forward that on to you once it's finalized, if that's helpful.
All right, that'd be great to get it to our legislative person, Eric, so we can take a look at that. Thank you.
And Councilmember Dillon, regarding the data, point well received. Kind of like what Chief Hall says, we're continuing, this is a work in progress. We want to make sure that data is not only useful to you, but useful to us, so we're looking at seeing trends versus just the one-dimensional data. So point well received. Work in progress.
Yeah, thank you.
Thanks.
All right, thank you very much. We'll go on to the discussion items, which we'll have item number 1, which is the uniform overtime report with Kevin Schmidt. Is that just a report, though? Oh, okay. Well, we'll go on to number 2, which is Maggie Yates and Adam McDaniel with the ordinance implementing community health impact area and the alcohol impact area.
Good afternoon, Council President, Council members. Thanks for having us. We are here just to give you an overview on the Community Health Impact Area proposal, which includes the alcohol impact area and the naloxone distribution ordinance. So Adam is also on hand in case there are questions that go beyond the slide deck here. So I'll first walk through the concept of the Community Health Impact Area, then the AIA, which is the Alcohol Impact Area, next the Naloxone Distribution Ordinance, and then we'll touch on sort of the timeline and next steps. If you have questions at any point, please don't hesitate to interrupt. Happy to answer as we go or at the end of the presentation. So we've been thinking since the start of the administration as to how we tackle sort of the dual and overlapping challenges of public health crises facing our community, as well as community safety and public safety concerns. And as you all know, they do overlap and they sort of influence the other. And so we have been looking at our own data, national data, looking at best practices and research, and also promising programs to narrowly and effectively tailor policy interventions that are going to help create opportunities for treatment in the face of the fentanyl epidemic, that are going to help us tackle criminal activity, and that are also going to help improve or enhance the quality of life for our residents, for visitors, and others who are living in the city, and specifically in this case, the downtown area. So first we'll go through sort of the data that we have and why we are looking at these two specific ordinance proposals, and then we'll talk sort of about the substance of the ordinances. So first, you can see that our emergency medical calls for suspected overdoses have nearly doubled just for our downtown Fire Station 1, in the last couple of years. And during that, during a similar time frame, we're seeing our number of overdoses increase, but the use of naloxone prior to first responders' arrival on scene is the lowest that we've seen in quite some time. Meaning that there's not access or sufficient access to Narcan for individuals who are experiencing overdose before those first responders arrive on the scene, or at least that's one of the sort of observations that we can make from the data. We can also see that alcohol-related offenses have grown about 60% in the downtown police precinct area over the last couple of years. And so this is when, during an interaction, someone is tagged as suspected of using alcohol during a call or in response to a call for service. We also know that state law prohibits the sale of alcohol from 2 a.m. to 6 a.m., but we are seeing 30% of our alcohol-related offenses take place between 12 a.m. and 2 a.m. And this is downtown. And we also, through informal trash surveys, have documented downtown proliferation of related trash from single-serve alcohol containers, both tall boys and miniatures. The alcohol impact area is not new to us and new to other jurisdictions in the state and even across the country. We had an AIA downtown and in East Central that were introduced, I believe, in 2010 and inadvertently repealed by the last administration in 2022 when there were some code updates being made. So what we're proposing through these ordinances is a new alcohol impact area that would be very similar to the same downtown boundaries that we previously had, but these would more closely mirror the downtown precinct. And that will really help us in terms of our data collection and evaluation of the initiative. There's roughly 17 off-premise liquor licensees in this downtown area within the borders that we're proposing. And sort of the two primary objectives are to reduce alcohol-related incidents between 12 a.m. and 2 a.m. and then also address the litter that's proliferating from single-serve containers. In order to impose an alcohol impact area, it first starts with a voluntary ordinance adopted by council, and that starts at least a 6-month process of the administration, the city working with the impacted licensees to adopt sort of our recommendations, although we can also identify other solutions, and we're eager to hear other ideas from impacted businesses to address the two primary objectives I just outlined. And then after the 6-month period, if we're still seeing the same challenges persist, we can go to the Liquor Control Board for an official AIA designation. And I think it's important to note, both because of the AIA process and also just to contextualize this initiative within the portfolio of strategies that we're pursuing, that it is one of many strategies that we're looking at. We also, of course, have our ongoing partnership with STARS and CAR 50 that provides rides for individuals who are intoxicated to treatment and medical interventions. We have the High Utilizer Initiative with Consistent Care, which I know is on the briefing schedule this afternoon. We have our clean and safe investments downtown, trash surveys that the Downtown Spokane Partnership is already helping us to implement, and several other initiatives that aren't listed here. Any questions? Yeah, Councilmember Cathcart.
Could you just detail what zoning changes and how does that affect these issues?
Yeah, one potential could be so like under state law right now, you can't have a off-premises alcohol outlet within 500 feet of a school, a church, et cetera. That's actually up to the discretion of the LCB. So if the city doesn't object to that, then they could technically license that facility within that area. So one idea is potentially do like we do for marijuana. So like marijuana, you can't open up a marijuana retail shop within 1,000 feet of a school, a church, a park, et cetera. So it would essentially just take it from LCB just to make a local zoning regulation instead.
Got it. Thank you.
Can we go back one slide here? One more, I guess. Yeah, right there, the before that one, or two after now. So the one where it says that the two AIAs were inadvertently repealed in 2022, and I think you said by a previous administration. And it needs to be known that the administration cannot make laws, right? We are the policymaking body. So it's improper to say that a previous administration let that lapse, because that's not true. We actually had a very public fight up here about this, and I advocated for us to continue the AIA. And we as a body decided we did not want to continue the alcohol impact areas. So if we're going to be assigning blame, I think it's proper for us to assign blame where it belongs, not with the previous administration, but with the previous council, because that's what ended up happening.
Council President.
So I'll just ask Maggie, since the original one included East Central, is there a reason why with this we did not include East Central at this time?
Yeah, based on the data that we were able to review, we're focusing right now on downtown based on the calls for service for emergency medical services and the calls for service related to alcohol in order to reintroduce this. And again, both ordinances are focused on the same borders downtown. So again, to reintroduce it and then to evaluate the impact, it doesn't mean that we would not want to explore imposing it in other neighborhoods as well. But this is just a starting point for us to, again, see whether or not it is remains effective and along with the naloxone distribution ordinance, and then we can explore how we can best deploy it elsewhere.
Thank you.
Okay, let's see if I can. Okay, so moving on to the second ordinance within the community health impact area, this would be an effort to require naloxone to be offered for free at the point of sale of smoking paraphernalia within the downtown precinct at businesses that are not regulated by the Liquor Control Board. So smoking paraphernalia includes pipes, bongs, and foils. As I mentioned, it excludes grocery stores, healthcare providers, or businesses regulated by LCB. And if the purchase of naloxone is not, if the business decides not to do that, they can remove those items for sale, but it would be the responsibility of the business to purchase and provide the Narcan or naloxone. As I think Council is aware, administering naloxone is protected under Washington's Good Samaritan law, and the Spokane Fire Department is willing and plans to provide Narcan training to the impacted businesses, and we also have a training video on the Emergency Management Department's website, along with places where naloxone can be procured. Off-site, so the businesses that we're looking at, these, because they're not regulated by the Liquor Control Board, they are not age restricted. Anyone can go in. They're oftentimes sort of promoted in the windows. One downtown is right across from a child care center. So for many reasons, problematic and a point of concern. And so we want to make sure, based on the data that we shared earlier with the low use of Narcan before emergency medical services, that we are making sure that it is available downtown, especially to individuals who may be in need of it. And this is the timeline moving forward. So if adopted by Council on February 3rd, the effective date would be March 5th for both ordinances, but that would, for the alcohol impact area, really just trigger that 6-month voluntary phase for us to work with the impacted licensees, off-premise licensees, to address those concerns and see if we can resolve them before moving to the Liquor Control Board for a formal designation. Councilmember Cathcart?
Yeah, I'm wondering if you could just talk a little bit about the decision to pursue the policy where we're going to require them to provide the Narcan, and what kind of the reasons for that are legally at the state level?
Yeah, so they are often sort of legal items, but we know that they are being used to consume illegal substances, and so we want to make sure that businesses who are selling them can still do so for legal means, but recognizing, based on the data that we have and based on what we're hearing from individuals, practitioners, public health experts, that Narcan is also available and that it's best practice to really saturate a community with Narcan. We all know that it is saving lives every day, and we want to make sure that that is really our focus, that we want to save lives, create opportunities for treatment, and in doing so, improve the quality of life for individuals and residents and visitors downtown.
Well, I guess maybe one of the things you said is we want to make sure they can continue to sell those things. And I think the idea is that we actually don't want them to continue to sell those things, which is the idea here. And the state does not provide us the ability to ban or provide a specific excise tax on those sorts of things that might make it more unpalatable for folks to buy or sell.
Yeah, I would just push back a little bit. If they're going to be sold, then we just want to make sure they're sold safely. And that is the intent behind this, of providing the Narcan at the point of sale.
Sure. But certain things like little foil squares, I don't think there's really any purpose other than fentanyl use for those sorts of things. And so, I just think there should be a strategy where we are pursuing a state law change to allow us to essentially adopt an alcohol impact area that does the same thing with those other goods. My other question is, how are we going to enforce this?
So this would be really enforced like a Class 1 civil infraction, so similar to what we do already. It would be complaint and or code enforcement, and we've talked to code about that, and they have capacity to help address this.
So theoretically, though, somebody would have to go into the store, buy an object, buy the item, go to the counter and purchase it and see whether or not the clerk offers them the Narcan. And that would be the only way that they would get to a point that they could complain. Are we going to have like some code enforcement people go in randomly and do those sorts of things?
Yeah, I think it's something we can explore, and happy to provide more information as we move forward to council.
Great. Thank you.
Go ahead, Councilman Kelly.
So 17, back on the AIA, so 17 liquor licenses with one pending. What is the kind of area-wise, how do you measure the downtown precinct? Because that's a lot for, I assume, I'm trying to, 18 basically, 17, one pending on this block area.
So are you asking for a map of the downtown
Yeah.
precinct? Yeah, we can get that for you. It basically is I-90 over to Overland Park, and then what's the eastern border for downtown?
Maple?
So it's I-90 and then the river,
Yeah.
High Bridge to Sherman.
Thank you.
And we can provide council with a map. Thanks, Adam.
And Maggie, will the business owners have to purchase the Narcan?
Correct.
And so, Maggie, is there an ordinance like this anywhere else in the state, or are we pioneering this area?
Not that we're aware of. This is something that we're, based on the data and based on what we know from public health experts and public safety experts, a promising intervention point.
Just a technical question, maybe more for Chris. Is this in such a way that an amendment could expand the boundary, or would it require a new ordinance to consider other geographic areas?
I'll have to look at it to answer your question. I'll get back to you offline, so.
Okay.
I think the alcohol impact area, because it's regulated by state, I think we would need something separate. Yeah.
This is kind of anecdotal, but I've been talking to people about this concept, and people were pretty horrified and shocked to find out that convenience stores were selling pipes and foils. The idea kind of scandalized most of the people that I was talking to. So I think maybe the goal is to have them stop selling these things. If you ask an ordinary person, is there any hope of maybe proving a point here and getting a little further down the road more authority to do things like that?
Yeah, I think it's a good question. And again, we'll want to see what the data tells us as we successfully implement this. I think sort of there are two options, is that if a business is going to choose to sell those items, then as I said, we want them to be sold safely with Narcan accessible. If they decide because they don't want to procure the Narcan, they're not going to provide it, then they're going to need to remove those items for sale.
All right, thank you very much for that update.
Chairman Zappone, we do need to confirm our sponsors at this point, and currently the sponsors for both measures are yourself, the Council President, and Councilmember Dillon.
I'm good with that. Are we good with that? Okay, confirmed. All right, we're going to go on to our standing committee and staff reports, which should be brief. Police Advisory Committee has not met for me. COPS, I don't know if you guys met since the last time we had a council meeting.
Yeah, and really it was just focused on trying to figure out how to respond to the RFP and what the timing of reimbursements and things like that would be. That was about the crux of it.
And then Chris, do you have an update?
Yeah, as you know, we've been working on our council rules, and you adopted those on December 9th. Since then, both Mr. Byrd and I have been working on educating staff in the city on the changes. I actually have an overview that I've updated and hope to present at Equity Subcommittee tomorrow to adapt at some point for a broader dissemination. I may enlist Ms. Ochiltree to help me with a flow chart, since I'm not very adept at that. The other thing that's certainly on the horizon is drafting of ordinances in the aftermath of the homeless roundtables, and where we want to go with those and what those will look like. And that, to some extent, that started in September, and we're still working on that, and I think hope to have something within the next couple weeks.
Who's we in that? We're working on that. Who's we?
Well, from a staff level, it's Ms. Ochiltree and myself. From a council standpoint, I think it's anybody. So
I'd love to meet with you this week, Councilmember Bingle, to talk about it.
Great.
All right, we'll go on to public testimony. The next item is consent agenda, but we don't have any requests for a briefing on that, so we'll go to public testimony. So we only have one person signed up, and that's Tyler Tamush. And do we have a timer set for this? That's okay. I'll have it on my phone. So thanks for being here, being our first committee testimony. You have 2 minutes to sit on. Thanks.
Happy New Year, Council. Figured I'd kick this off. Why not? Talk about the alcohol impact area. I think that's a good thing. I wish it was something we could expand out further. I think Councilmember Cathcart had kind of brought something up as far as maybe expanding those boundaries. Seeing the pictures of the litter of all the alcohol, that is something that I know in my neighborhood council, when we do our cleanups along the north-south corridor, I'd say about 75% of what we pick up is alcohol containers. The small ones, the cans, just pretty much anything. So definitely a lot of litter along there. That's been a big concern of ours for that north-south corridor. So definitely something I want to look at going further with that. As far as the paraphernalia thing, kind of in agreement with a lot of the people that are sharing concern that these products are being sold. I think we should be pursuing a state law where this isn't allowed. They shouldn't be selling foils. They shouldn't be selling chillums or whatever it is that they allow that these people use to smoke these drugs out of. We need to get the drugs off the street. It's just as simple as that. We shouldn't be, as much of an advocate as I am for saving lives, I think that's definitely a big thing. We need to keep people alive. I think, people should be able to live their lives to their fullest. But I just feel like if we're going to be providing the Narcan, I think a lot of people, at least from a lot of the things I read that people will post on social media and stuff, keyboard warriors, all that cool stuff, but they just kind of say like it's more of just allowing it to happen. Like it's just kind of advocating, here, just do it safely. Go ahead and do it. So I just don't agree that, it just shouldn't be, we should just not be selling these products. I mean, you could easily go to a grocery store, buy some foil, roll it up, do what you got to do. You don't have to go into those stores and buy whatever pipe or whatever it is that you can use. So it's I think it's a very complex issue as far as something like that goes. I mean, you might as well have the grocery stores carry it too, because you can just get whatever you'd like and buy it. So yeah, appreciate it.
All right, that concludes our January 6th Public Safety Committee meeting. Our next one will be February 3rd. Thanks.